Okay, welcome everyone to MDHI's How to Administer an Assessment for the Coordinated Entry process. My name is Nikki Rising. I'm a one-home coordinator. Also joining from the MDHI team is Jazz Foster, who works on our HMIS team. Okay, so today we're going to talk about a couple things, and I want to tell you a little bit about how the idea for this training started and how it evolved. So I really started with the intention that we wanted to be able to give a more in-depth training around the VI-SPDAT, really get into why we ask the questions that are asked on there and how to interpret them, because we know that some questions on the VI-SPDAT can be interpreted probably in several ways. So we wanted to be able to let you all know and get some training around that. So as we were going through this process, we also learned that it's really important that we also talk about the racial inequities in the VI-SPDAT. As of recent, it has been widely accepted that the VI-SPDAT is inequitable. So what we want to do is acknowledge that, talk about it, talk about these inequities, go through each question and really dive into them. And then also implement trauma-informed practices to help reduce these inequities. So what we're going to do is we're going to go through every single question and talk about how some of these questions can be made more equitable, keeping in mind that the VI-SPDAT is intellectual property that is owned by org code, so we cannot change the questions at all. They have to be asked exactly how they're written, but we can change how it's delivered and some things around follow-up questions and what we can do around how we administer. So those are the two objectives that we're going to talk about today. Again, going through some racial inequities of the VI and how to make it more equitable, and then understanding each question and how each question should be interpreted. All right, so why do we have an assessment for the coordinated entry system? One, required by HUD. So HUD requires that each COC, so our COC is the Metro Denver COC, has an assessment form, tool, or approach for its coordinated entry process. Our COC has chosen chose the VI-SPDAT a while ago, and we still use that today. Additionally, there are not enough housing resources, so the assessment assists with the referral and matching process to house the most vulnerable. We'll talk about the prioritization that we have for these vulnerabilities later on in the presentation. Also, data is collected from these assessments to help inform better housing strategies. All right, so as I mentioned, the assessment that we use for Metro Denver COC is the VI-SPDAT. The VI-SPDAT stands for Vulnerability Index, Service Prioritization, Decision Assistance Tool. Well, lots of words, why we say VI-SPDAT. It's important to remember that this is a triage tool. It highlights areas of higher acuity, thereby helping to inform the type of support and housing intervention that may be most beneficial to improve long-term housing outcomes. It also helps to inform the prioritization in which people should be served. We're going to get more into that as well, as I mentioned. All right, so is the VI-SPDAT equitable? Short answer, no, it is not. We're currently working with a consulting agency called C4 Innovations, which I'll talk about a little bit later. But they did an entire study around the VI-SPDAT and its inequity. And so the big thing that was pulled from that is in this blue circle here. So I'm going to read it to you. VI-SPDAT subscales do not equitably capture vulnerabilities for Black, Indigenous, people of color, also called BIPOC, compared to white individuals. Race is a predictor of 11 out of the 16 subscales, and most subscales are tilted towards capturing vulnerabilities that whites are more likely to endorse. So again, on average, BIPOC clients receive statistically significantly lower prioritization scores on the VI-SPDAT than white counterparts. So with the scoring, how the VI-SPDAT scores, right, as it was intended, those who are white are scoring higher, which means that they are being prioritized to PSH more often than those who are BIPOC. So why are we still using the VI-SPDAT then? Right, we know that it's inequitable. And so why do we continue to use this? And the answer is easy and complicated at the same time. So while the VI-SPDAT can be traumatizing and is inequitable, it's necessary for current use while we explore how to implement a more equitable assessment. So the VI-SPDAT itself took years to, to come to fruition. Lots of studies were done on it. It was tested, piloted, created, with a lot of different expertise coming to the table. So creating a new assessment takes a lot of time. And it is something that we are trying to work on and are aware of it and would like to create a new assessment. But again, it is going to take a lot of time. So we are currently working with C4 Innovations. As I mentioned, it's a consulting agency dedicated to building racially equitable systems through process improvement to look deeply at the racial inequities in our coordinated entry system as a whole. So not just the VI-SPDAT. The Results Academy is a group that consists of community leaders and partners, direct care providers who interact with the coordinated entry system, and individuals with lived expertise and experience of the coordinated entry system. The Results Academy will examine data collected from a community survey that was provided back in February that some of you might have done, that C4 created. So we are definitely in the very beginning stage of evaluating and looking through our entire coordinated entry system. So really just collecting data, seeing where we need to make those improvements right now, and making sure that we're doing this in a very intentional way. Really putting a lot of work and effort into this, bringing in the consultants to help. C4 Innovations has been also consulting with several other COCs in the nation around this. So we have a lot of trust in them as well around their work with us. All right, so any type of assessment we are doing, we want to make sure that we are implementing a comprehensive trauma-informed approach. I know that many of you probably sat through the trauma-informed care training yesterday, which is great, great leadway into this for me, so that's awesome. So I'm just going to talk really quickly, right? Trauma-informed care is a whole training that people should take. So I'm just going to go through some big key things about a trauma-informed approach, specifically around administering the VI-SPDAT. So the first one is client empowerment. We want to make sure that we recognize that as an assessor, so as you're giving the VI-SPDAT, you automatically sit in a position of power because you are the one administering. So we want you to be aware of that and try to break down those barriers. We want the client to feel that empowerment, to feel like and to know that they deserve housing, that they are deserving of this, that they get to choose in everything through this process what happens. And that goes on to the client choice as well, right? Remembering that each of these, we want to take an individualized approach. Everyone is different. Every household, every client has different needs. And remembering that people are the expert in their own lives. The third one is collaboration. So this means not only collaborating with those in your agency, but also agencies throughout Metro Denver as well. because we want to make sure that people are getting that comprehensive care. And then, of course, we want to make sure that we have that safety aspect whenever we're doing an assessment, right? This assessment in particular, the VI-SPDAT, can really, it brings out, it asks questions that can bring out a lot of feelings in people. It is traumatic. Some things are probably going to be brought up, so you want to make sure that you are providing that safety aspect while you are going through this assessment. The fifth one is trustworthiness. So the thing that I want to talk about with this one is that best practice, and what we would like for you to do, is not do a VI-SPDAT the first time you meet someone. So we want to make sure that we're creating that trustworthiness, right? And we'll talk about this a little bit more and why that is so important. But we do want to make sure that, right, that we have a connection or some sort of trust built with the client before we're asking them all these very invasive questions about trauma, about, you know, disabilities, about their risk exploitation, about their emergency service needs. We want to try to make a little bit of that trust, a little bit of that connection before we just dive in and start asking these really, really invasive questions. And then always remembering, right, that the trauma-informed care, we focus on what happened to you and not what's wrong with you. Okay, so we know, right, that the VI-SPDAT has questions where people are really gonna, might open up a lot, might start telling you their stories. Which is not the intention of the assessment, but can happen, and we know that that happens. And so we want to make sure that as we're doing this assessment, we're also demonstrating empathy. So really leaning into that, you know, saying, I'm sorry that this is happening to you. I know this is extremely difficult for you, and reaffirming that if they do start to open up. Right, so we also want to remind everyone that, you know, one does not have to be a therapist to be therapeutic, right? So we aren't doing therapy here, but we are offering some sort of support and acknowledging when people start opening up specifically around their trauma. So along with that, we know that sometimes when people open up, it can really go into, like, the floodgates can open, and they can really start talking a lot about their situation and about, you know, feel like they have to explain why they answered yes or no to a question. So it's really important that we don't get into that during the assessment. We want to make sure that we're redirecting some of these conversations in order, and to do that in a balancing sort of way where we find a safe space while keeping the client on track. So we'll show some of these examples later, but a great way to redirect the conversation is using this quote here. So, I know that it's an important concern of yours, and I'd like to come back to it. And right now, I'd like to make sure we're focused on getting you into housing. Is it okay if we go back to, and then referencing the question that you were just talking about? So it can happen in these assessments that, you know, you learn that the client really wants to be given referrals to therapy or SNAP benefits or legal consulting. And that's really great. And it's something that should be addressed after the assessment is completed. So we want to make sure that we are focusing on the assessment while it's happening and really focusing on getting those yes, no, or one-word answers. So along with that, right, so most of the questions on the VI-SPDAT only require a yes, no, or a one-word answer. And the reason for that is because closed-ended questions eliminate the feeling that they need to justify their answers or situations. We don't want people to feel like they need to justify, you know, why they answered a certain way. in order to justify why they deserve housing or need housing. We want to make sure that we're eliminating that. And a way to do that and to make the assessment more equitable is to remind people, as they start to it might feel like they start to explain things or try to justify things, that we just need a yes or no answer, right? And finding that balance between I hear you, and we also need to redirect this and get this and do this assessment, and we can talk about things after the assessment. So jumping into that, we're going to talk about housing first. This flows nicely into the housing first model. So, keeping in mind that there are several questions on the VI-SPDAT where many experiencing trauma have been conditioned to lie in order to survive, right? So they might feel like they need to lie to you about a certain question because in the past, the truth eliminated them from housing or got them evicted from housing, or some sort of negative thing happened around their housing when they told the truth. And also some of these questions, very, very traumatic. And even being asked that question can feel shameful. To be asked, what your drug history looks like, or if you have substance abuse issues, even asking that in itself can feel very shameful to even be asked that. So remembering that, and remembering that shame has been perpetuated in systems historically. And we want to move away, we want to shift away from this deserving versus undeserving, right? So we know, especially with the housing first model, everyone deserves housing. So we want to use those housing first principles, especially when we're doing the VI-SPDAT, where we're focusing more on screening people in rather than screening people out. So what we're trying to do with this VI-SPDAT is look at what type of housing option would be best for the client. We're not saying housing is appropriate for you or not appropriate for you, right? Housing is for everyone. So what we're trying to do is see what type of housing would create the most success. And this shift, is not only happening with providers. We talk about the housing first model all the time as providers, but the shift is also happening with households active in the system. Keeping that in mind, that the shift is happening with your clients, with your households, and helping them go into that shift as well, where they don't have to see themselves as deserving or undeserving of housing, that they deserve housing. They are here to get housing, and we're going to work with them to do that in the best way for them and what they think is best for them. So some examples of that, are validating that we do have resources that don't have a sobriety as an eligibility factor. And there's some other examples that we'll go into later, where we get into the disabling conditions questions. All right, so we're going to really dive into some DEI work, diversity, equity, and inclusion. This is where we're really going to dive in, keeping in mind that, a DEI training is very intense. So we're going to hit on a lot of this work that is directly related to administering the VI-SPDAT. So while I think a conversation should be had in all of your organizations regarding DEI work, we are going to focus specifically around administering an assessment. So I first just want to start us off by talking about systemic racism. So systemic racism is racism that is expressed in policies, procedures, processes across economic, social, and political institutions that discriminate, oppress, exclude, harm people of color. This is what creates disparities in income, educational opportunities, employment, housing, healthcare, criminal justice, etc. So I'm going to acknowledge that I am a white person talking to you about systemic racism. And I want to acknowledge that, and I want to be very upfront about this. I am aware. I also want to explain to you why we're doing this, why we're doing it this way. So we're doing this so that the emotional labor of teaching DEI doesn't continue to fall on our BIPOC staff, and that this training was made in collaboration with MDHI BIPOC staff, the BIPOC community, and those with lived experience. We really are trying to move away from expecting the BIPOC community to teach us about these things, and take away that emotional labor of having them consistently feeling and doing that work. To get us a little bit deeper, I wanted to share this quote from our 2022 State of Homelessness report. And this is about recognizing disparities in our homelessness systems. So I'm going to read this to you. While there are differences in the definitions, count types, and methodologies between the data sets, there are some clear commonalities. This year's report once again demonstrates the overrepresentation of BIPOC individuals experiencing homelessness across all data sources. This is the result of systemic oppression and policies which continue to perpetuate this racial disparity. Second, homelessness continues to be one of the most pressing challenges in our region and is the direct result of economic conditions such as lack of affordable housing, wages which do not keep pace with the cost of housing, cost of living, and gentrification. This is a graph to show the race inequity that's happening in our homelessness system. So this again is taken directly from our State of Homelessness report. An overrepresentation is seen in the Native Hawaiian Pacific Islander communities, American Indian and Alaskan Native communities, and Black and African American communities. So the one data point, we could talk about this forever, but one data point that I just want to really highlight here is this, the third graph down about Black and African American, the Black and African American population. So right, that blue line is showing how many in the Metro Denver region are Black and African American. That's the general population. That's around 5% of the Metro Denver total population is Black or African American. That red line above it shows how many in our HMIS system, so in the homelessness system for Metro Denver, are Black. And that is almost 27%. That is a huge disparity, huge, right? So 5% of the general population is Black, 27 of the homeless population in Metro Denver is Black. Being aware of these racial inequities in the homelessness system is really important. Next, we're going to talk about racial trauma. So, right, we're going back to that trauma, around trauma-informed care. So trauma is any type. Trauma of any type can affect a person's choices, reactions, perceptions, attitudes, fears, and coping strategies. Racial trauma specifically can contribute to increased vigilance, suspicion and distrust, which we talked about a little bit before, hopelessness, and substance use. Racial trauma can change a person's views of people, events, and experiences. It's also important to keep in mind, especially as you're doing this assessment, that racial trauma can also cause a person to avoid going into service settings where they will be the minority or have historically experienced discrimination. So I just want to give a few examples of racial trauma. So those can be microaggressions, minimalizing, others not taking experiences of racism seriously, witnessing members of a person's group receiving abuse, and then racism and discrimination. So people, right, when they seek out help where they have been underserved or served poorly, they're less likely to seek out help or represent themselves authentically. All right. I'm sure you all have seen a lot of different images around equity versus equality. So we at MDHI thought that this best represents the differences here, right? So equity refers to proportional representation of opportunities in housing, healthcare, employment, and all indicators of living a healthy life. So the equity piece, this top part of the the equality piece, the top part of this image here shows, right, if someone is trying to get somewhere and we want to give them a mode of transportation of a bicycle, and we say, okay, here's a bicycle, we give everyone the same bicycle, that is equal, right? We're helping them get somewhere, we're helping provide them transportation to a place. But each person is getting the same bicycle. So while that's equal, it is not equitable. So if we go down to the second part of this picture, we see that if we provide people with the tools that are specific to them, so right, we're providing them a bicycle that is specific to their needs, that is equity. And that is what we're looking for here when administering the VI-SPDAT in all of our work, in coordinated entry, in direct service, in shelter, in anything that you're doing. This is what we're focusing on, equity. It's important to remember that to achieve equity, policies and procedures may result in an unequal distribution of resources, but will lead to equitable outcomes for everyone. A few more tips in regards to administering the VI-SPDAT, right? Don't use the assessment judgmentally. Do not make assumptions. Again, reiterate that most questions only require a yes or no answer and that no additional information is necessary. You may also find it more trauma-informed to prep certain questions that are particularly difficult or invasive. So for example, if you know that your client or household is going through a domestic violence situation, when you get to that domestic violence question, prepping them, saying, you know, this question might be a little bit difficult. I just want to let you know. Also important to know that an assessment tool provides data. It does not make decisions, it informs decisions. This tool is not perfect. We've talked about that, and it will continue to evolve and improve. We really want you to continue to have an active voice in making it better. Another tip, if a household has answered a question differently than what you know from previously gathered information, follow-up questions are encouraged. So we're really going to get into a very specific example of this on question 8. And then if a question has already been answered, say during intake or through a conversation, there's no need to ask that question again. Before we do the VI-SPDAT and in all of our work continuously, we want to make sure that we are using diversion. Well, we could do an entire training on diversion. There are many trainings out there about it. So I'm not going to get too into the weeds on this one, but we do want to talk about it a little bit. So if you are unfamiliar with diversion, it is an intensive service intervention through an interactive problem-solving conversation with the client. Staff seek to understand what caused a person's housing crisis, explore what immediate solutions to the crisis may be possible, and help them pursue a solution. So I'm going to give an example here because diversion, I think, can be a little bit confusing. So I'm going to give a very specific example. So say someone is entering shelter, and you ask them, where did you stay the night before? and they say, oh, I stayed at a friend's house. Say, okay, was it safe? Yes, it was safe. Okay, why were you asked to leave? And the client explains that they were asked to leave because the people that they were staying with could no longer afford for that client to live there. Their utilities bills were going up, and they did not have enough money to pay the utilities, so they asked the client to leave. So a diversion conversation can start with, is there a way where you can stay with those friends? Is there any support that can be given, whether that's monetary support or some case management support, perhaps talking, doing some conversations with the friends that you're staying with in order to be able to stay there? So what we're trying to do is help people not enter the homelessness system. We don't want people to become homeless if there's another option. So having these diversion conversations and really talking about, okay, it sounds like you have an option so that you don't become homeless. Let's explore that deeper. Let's explore what we can do in order to avoid you going into the homelessness system. Because as soon as people enter into the homelessness system, as soon as that client, say, goes into the shelter system, they're in it. They're in the homeless system. And it's more difficult to get out of it rather than working on that diversion piece and making sure that they don't go into it in the first place. So who qualifies for a VI-SPDAT? There are two qualifications. So one, the household is experiencing literal homelessness as defined by HUD. The next slide, I'm going to put up the HUD definition for literal homelessness. And the household has been homeless for at least 14 days if this is their first time experiencing homelessness. So it's that very first time, right? Say it's that client that came in and said, I got kicked out of my friend's place, and that's their first time experiencing. You want to wait 14 days before doing a VI-SPDAT. And the reason behind that is because most people, a very high percentage of people whose it is their first time experiencing homelessness, can self-solve within 14 days. So we don't want to enter them into a system without giving them time to self-solve and to really figure out their situation first and see what they can do with either their own doing or minimal support. We want to have a lot of trust and a lot of faith, I guess, that our clients know what's best for them. We want to give them that chance to solve problems and to really use their problem-solving skills and try to self-solve their homelessness. So once you've identified that a person does qualify for the VI-SPDAT, you first want to look them up in HMIS to ensure that a VI-SPDAT has not already been completed. If it is the case that a VI-SPDAT has been completed, you can go through some of the questions with the client, and if things have changed, we want you to go in and do a current living situation. We do not want you to do a whole nother VI-SPDAT, because we know that the VI-SPDAT is traumatizing and we really only want that done once. So further on, we're going to go into this a little bit more and explain the current living situation that's in HMIS and how to complete that. Then you want to complete the one home intake form and the one home initial screener. It's also important to know that if a household is inappropriately assessed, so say that they are couch surfing or they're staying in a hotel that they're paying for themselves, they will be removed from the community queue as they do not meet that definition of literal homelessness, which is here. HUD jargon, always so much fun. So this is the literally homeless definition that HUD gives. I'm not going to read this to you. So we're looking at people who are in shelter, who are living in a place not meant for human habitation, who have been in an institution for less than 90 days, and those in transitional housing. And speaking of transitional housing, just a little quick note on that. Transitional housing is a little bit different. So People in transitional housing do meet the definition of literally homeless. However, once they are in transitional housing, it does break their chronically homeless status. So just something to keep in mind that this is the only type of programming where that happens. So if someone enters sheltered, that their chronically homeless status does not have a break, but in transitional housing, it does. All right, there is one situation where people can be entered into HMIS and a VI-SPDAT can be completed if they are at risk of homelessness and do not meet the definition of literally homeless. And this is, you would complete a TAY VI-SPDAT, which we'll talk about soon. That stands for Transitional Aged Youth. And so 3 things have to be true in order for you to do a VI-SPDAT if someone is at risk of homelessness. So 1, they have to be age 18 to 24. 2, they have to meet the HUD definition of at risk of homelessness. 3, they have to have been in foster care at least 1 day on or after their 16th birthday. And this can include young people in institutional placement or Department of Youth Services. Again, only time you are able to complete a VI-SPDAT with someone who does not meet that literally homeless definition. And this is because we do have a housing program that is specific to this population. Okay, so there are 3 types of VI-SPDATs. So one is the family VI-SPDAT, another is the TAY that we just talked about, or youth VI-SPDAT, and then the individual VI-SPDAT. So we want to make sure that you are doing the correct one. So for a family VI-SPDAT, we want to make sure that the household has at least 1 child under the age of 18, and that the household has at least 50% custody of the child or children. For youth, this is age 18 to 24. You only want to do the TAY if it's an individual youth. So if a youth head of household has children, then we want to make sure that you do a family VI-SPDAT. So any type of household that has children in it, do a family VI. And then individuals doing over the age of 18 with no children. And this part can be a little bit confusing, so we want to provide some clarification on this. But if 2 people come up to you and they're a couple and they want to live together and they're both over the age of 18, we want to make sure that you're doing the individual VI-SPDAT on both people separately. We want to make sure that you're doing them separately, right? Due to safety issues, especially, for example, if there's some domestic violence going on and say you get 1 member of the couple, you're doing the VI-SPDAT with that person and they say, you know, I actually don't want to live with the person I came in with. And so then it's also a way to talk about safety and how to go through that. And then couples can be connected in HMIS and entered that way, but we do want to make sure that we're doing those VI-SPDATs individually. Okay, one way that MDHI has been focusing on how to make the VI-SPDAT more equitable is that we changed our prioritization. So right in the beginning, we talked about the VI-SPDAT is inequitable because those who are white tend to score higher. So what we've decided to do is we are no longer using SCORE. We're not using it at all, as it shows significant racial disparities. So instead, we've created new prioritization based on racial equity. The family new prioritization started in October 21. Individual started this year in January. And then the young and youth adult prioritization is still in process. Next, we're going to go through each one of these prioritizations so you can get an idea of what those are and how they are directly related to the VI-SPDAT as you are completing it. First, we're going to go through family prioritization. So first prioritization is households or head of household is currently fleeing DV. So this question is actually not captured on the VI-SPDAT. This question is captured on the one home enrollment. So we also want to make sure that you're doing that one home enrollment as accurately as possible. So then from there, we sort by age of youngest child and length of time homeless. Then we move into the second bucket. Household has experienced DV sometime in their lifetime. So this is prioritized by how the length of time since the DV. So the closer that has happened in recent times, those folks are prioritized. And then we sort by age of youngest child and length of time homeless. Then we move into the third bucket. There's households who have 3 or more disabling conditions, and we then prioritize those based on age of youngest child and length of time homeless. Individual prioritization. So they have to meet all 3 of these priorities. So one is that they have 3 or more disabling conditions. So a TBI, developmental disability, mental health, substance use disorder, chronic health condition, or physical disability. And they have some sort of systems involvement, and they are currently fleeing DV, domestic violence situation. And then from there, we separate rapid rehousing and PSH based on length of time homeless. So those who have been homeless for less than 36 months are prioritized for rapid rehousing. Those who have been homeless more than 36 months are prioritized to PSH. And then the youth and young adult prioritization. So this is the current one. So first is that they have a chronic health condition. Second is significant criminal justice involvement. And third is length of time homeless. And then the housing intervention type is determined within case conferencing. And so, right, the prioritization is currently in the revision process. Right now, we're gathering feedback from providers and WALP and Catalyze in order to make those prioritizations more equitable. I'm going to continue on. The next part of this, we're going to go into every single question on the VI-SPDAT. So enjoy the ride. Okay, so we want to make sure that we are using the same opening script for everyone that we're encountering. We want to give the same messaging to every household, every client that is completing the VI-SPDAT. So I'm going to read this to you because I think it's important to hear this out loud. Oops. My name is Nikki and I work for MDHI. I have a short survey that I would like to complete with you. The answers will help us to determine how we can go about supporting and housing you. Most questions only require a yes or no. Some questions require a one-word answer. I'll be honest, some questions are personal in nature, but you can skip or refuse any questions. If you are unclear about what I'm asking, just let me know and I will try to clarify. Also, if I'm unsure about any of your answers, I will ask for clarifications. The information collected in the survey will be stored in a secured database, the Homeless Management Information System, with your consent, so that you will only have to fill out this paperwork one time. Many of the agencies in the Metro Denver region are part of this system. If you choose to not give consent, you will still be eligible for coordinated entry. One last thing before we begin. I've been doing this long enough to know that some people will tell me what they want me to hear, rather than telling me or even themselves the truth. It is up to you, but the more honest you are, the better we can figure out how to support you. So please answer as honestly as you are able and feel comfortable. You should still work with a case manager to help you apply for housing once you have finished this survey, as completing this is not a guarantee of housing. So again, we want to make sure, and we'll share this on our website, but we want to make sure that this opening script is used for every single person who is completing the VI. Sub-regional determination, just like a quick note on this, and this kind of gets into the Built for Zero by name list. But first of all, if housing programs eligibility is tied to a sub-region, so say that, you know, a housing provider says they only want to house people in Adams County. The sub-region where the household is currently receiving services will be used to determine the household sub-region. Additionally, sub-regional data is used with our COC's Built for Zero work, so that's the work that we're doing with veterans. The household will be placed on the by name list in the region where they are receiving services most often. So we have 9 sub-regions for Built for Zero, and on the by name list, whatever region that veteran is receiving services the most is the sub-region that they will be assigned to. Okay, let's do it. Question number 1 on the VI-SPDAT. Where do you sleep most frequently? So you can help by making the context more manageable. You can also say, like, ask this question if they're having a hard time, the household is having a hard time answering this question. So say because they move around pretty frequently, you can ask the follow-up of where did you sleep the most in the last month or week to help them really narrow down what frequently means. So you can ask this follow-up question here. Question number 2, how long has it been since you lived in permanent stable housing? So permanent housing does not include transitional housing or sober living facilities. And stable, the definition of stable, is housing that is reliable and that the person can return to every day without fear of being locked out or having to move frequently. Question number 3, in the last 3 years, how many times have you been homeless? So you can help by including some context here. So saying like since July 2018, so that they aren't having to do all that math and going back 3 years. You can do that math for them, and that would be super nice to help give some context. If someone is having a hard time coming up with this number because they've moved around so frequently, it can be helpful to start at the beginning. Say, okay, on July 2018, where were you staying? Or around July 2018, where were you staying? And say, okay, how long did you stay there? And working from the 3 years back and going forward can help determine those episodic instances of homelessness. Question 4, in the last 6 months, how many times have you? And so again, you can help this by giving an exact month, right? Because most of our clients are living in this survival mode, time can be a very relative term. So you can help by giving the last month, right? So since October, how many times have you? So these questions are: receive healthcare at an emergency department or room, taken an ambulance to the hospital, been hospitalized as an inpatient, used a crisis service, including sexual assault crisis, mental health crisis, family intimate violence, distress centers, and suicide prevention hotlines. Talk to police because you witnessed a crime, were the victim of a crime, or the alleged perpetrator of a crime, or because the police told you that you must move along, particularly for people who are living unsheltered and police are asking them to move frequently. And then stayed 1 or more nights in a holding cell, jail, or prison, whether that was a short-term stay like the drunk tank, a longer stay for a more serious offense, or anything in between. So these questions are all looking at the frequency of the respondent's interaction with various emergency services. So we know that the more vulnerable or higher acuity that a client has, it tends to be that they use more emergency services. So this can be a good indicator of that. Question number 5. Have you been attacked or beaten up since you've become homeless? So the time frame indicates any time that the household has been homeless. Right? So a couple of our questions have been like within the last 6 months or within the last 3 years. So this is throughout their lifetime. So anytime that they've been homeless, have they been attacked or beaten up? So it's really important to keep in mind with this question. This is a very inequitable question. And the reason behind that is because violence has been normalized historically in many communities, including people of color, elderly, LGBTQ, women, people with disabilities, and youth. So really keeping this in mind that this might be a question where someone might feel shameful even being asked this question, or might feel like they need to lie even in order to feel like they are justified in receiving housing. Question number 6. Have you threatened to or tried to harm yourself in the last year? So again, help with some context here, time-wise, like since April 2021, can really help with that because again, we're changing timelines a lot. So this one is in the last year. Self-harm, the definition here is includes failed attempts to harm yourself or others. And remember that no detail is needed, right? So reminding the client, if you start to feel or sense that they're uncomfortable by the question or they start going into a lot of details, reminding them that this is just a yes or no, right? There are going to be some people who have experience or knowledge with mandated reporters. So if follow-up information is needed, please provide. So it might be that some people think if they answer yes to this question, that you will have to do a report because you're a mandated reporter and you need to report that. But that's also not what we're looking for here. Of course, if someone is in immediate danger and are talking immediately about harming themselves or others, yes, we do need to report that. We do need to make sure a wellness check is done and everything like that. However, that is not specifically what this question is getting at, right? The question is specifically asking, have you threatened to or tried to harm yourself in the last year? Question 7. Do you have any legal issues going on right now that may result in you being locked up, having to pay fines, or that make it more difficult to rent a place to live? So I want to keep in mind here that if there is a legal record that shows someone after eviction or series of evictions that a potential landlord would discover when running a background check, then consider it a legal issue. However, you should not in any way attempt to influence this answer of the individual you are surveying with this information or in the question with eviction history would count or things like that. So remembering that we want to ask the question exactly how it is worded here or written here. You can ask some follow-up questions, or if people are having a hard time understanding the question, it's okay to clarify, but we don't want to attempt to influence this answer or really any answer. Question 8. Does anybody force or trick you to do things that you do not want to do? This can be, I just want to preface this one by saying that this can be a really difficult question for some people to answer because sometimes people don't realize that they're being tricked to do things. So I want to give some examples here. Some examples of manipulation can be around SSI, SSDI. So say that someone is receiving those benefits, but their money, doesn't go directly to them. Say they have a family member who's a payee who takes advantage of that and uses the money for themselves instead of giving that money to the client. Another one is expectation of shared resources. So we see this pretty frequently with people who do get money and pay for, motels for that first week that they have their money, and that certain people around them expect that they will then also share that hotel with that person, even if they don't want to share the hotel. The person that has the money does not want to share the motel. Also domestic violence situations and control over resources. So say that a client has paid for a phone, but that someone else has taken it and is using that for themselves. So anybody can also include service providers. So if they feel like a service provider is forcing or tricking them to do things they don't want to do, again, they do not need to go into detail about that, which is why this is a yes or no question. And then also note here that the BIPOC community does have a higher risk of sex trafficking. So if someone is being sex trafficked, this is where the answer to that question would be yes. Question number 9. Do you ever do things that may be considered risky, like exchange sex for money, run drugs for someone, have unprotected sex with someone you don't know, share a needle, or anything like that? Again, really want to emphasize that this one only requires a yes or no answer. When I've done hundreds of VI-SPDATs, I have frequently have people say, well, yeah, I have unprotected sex with someone with people I don't know. So it could be very beneficial for you to preface this question by reminding them that this question only requires a yes or no answer. And then if they do start to feel like they need to justify or explain the answer to their question, redirect. This also is is intentionally vague at the end by saying anything like that, because we do want to leave it open to the client to determine what they consider risky. All right, so here's an example. This is from question 8. Let me go back for a second. So question 8 was, does anybody force or trick you to do things that you do not want to do? You're going to go through a specific example for this question. So one provider shared, they've clearly said yes, that they've been a victim of domestic violence. But when you ask them in the VI-SPDAT, has anyone hurt you or forced you to do things you do not want to do, they say no. You can then ask a clarifying question. You can say, okay, well, earlier you mentioned domestic violence. Does that mean that's not affecting you right now, or can you just clarify that for me? Or you can ask them the question again and remind them of the earlier answer. This is a really good example of how you can ask follow-up questions. Another example of this is there was a period of time where one of the court systems in Metro Denver was referring people to me in order to get VI-SPDATs done. And we would get to the question about legal issues, if they were going through legal issues, and if a client would answer no and say, okay, help me understand this. You got sent to me from the Arvada court system. Does that mean that those legal issues that are going on right now are not current? And just making sure that you're following up if you know some information to be true. It is okay to do that, and you should do that. Question 10. Is there any person, landlord, business, bookie, dealer, or government group like the IRS that thinks you owe them money? A keyword here is thinks. And then question 11, do you get any money from the government, a pension, an inheritance, working under the table, a regular job, or anything like that? Again, emphasize this is yes or no, especially, people can get money in ways that they see as shameful or can be perceived as shameful. And so again, reminding them that yes or no answer is the only thing that is needed. Don't go into a lot of detail on these two questions because they were actually found to be equitable questions. Question number 12. Do you have planned activities other than just surviving that make you feel happy and fulfilled? These are activities that they choose that provide personal satisfaction and a sense of intellectual, social, emotional, physical, or spiritual fulfillment. Jazz does a really great job of explaining this question more. So we're going to have a celebrity come in and explain this to us.
One, you didn't warn me about this, but okay. Okay, so when we go through the VI-SPDAT, I think you guys will see there are a lot of questions that seem very big and very important, and that's like we're going through these, right? And this question on the surface, I think it seems not as important. However, I think that arguably this is one of the most important questions on the VI-SPDAT. As people, as humans, something that we have to have really a drive to keep moving forward is hope. So when I explain this to people, I really kind of talk about, we've all been to like a water park, and there's like that big wave pool, the waves come on, they turn off, so on and so forth. For everyone else, we are the standard person who has come to the pool to do what we do. The waves come on, the waves go off, etc. For clients experiencing homelessness, they are in the deep end, the waves never stop, and most of them don't know how to swim. When you are experiencing homelessness, every day, every moment is always just about not drowning. It's survival is all about not drowning. So when you think about treading water and that's what you're doing is literally just trying to survive constantly, it's exhausting. When we think about things, something very simple as I am thirsty and you want to get something to drink, all of us, we get up, we go get something to drink. And that is as much as we think about. The problem being that we need water, and the need being fulfilled by giving self that water. If you are someone experiencing homelessness, though, that thought process, it snowballs, right? It's much bigger and it's much heavier. It's not quite so simple as I have a need of something to drink. It is, and then it is not then filled by giving them something to drink. If you have someone who's thirsty and you give them a gallon of water, they then have to transport the water, store the water, have a bathroom, have toilet paper. And you have to think about it in those terms. You know, clients are making the decision of, you know, I want something to drink, I need something to drink, but if I drink it, I am then going to have to go to the bathroom. Am I going to have access to a bathroom when I need to? Am I going to have toilet paper? Am I going to have somewhere to wash my hands, somewhere to be clean, like to clean yourself, all of these things. So every small thing, one small need that we presume of water, it's not filled by just providing that client water, right? That's not that we don't solve the issue, because your clients have to constantly think in terms of every scenario, every circumstance, and however it comes out. So yeah, in terms of life, they are just always treading water, trying not to drown, and it's exhausting. So I really want to encourage you guys to take the time, this question, to understand more about your clients. What are the things that bring them joy? What are the things that bring them hope? What fills your client back up to continue to push forward and continue to survive? Because if all you're ever doing is treading to not drown, eventually you get tired, and you will, right? It's not sustainable. So what continues to give your client strength? And once you find out more about that, what are also some community resources that we can utilize to get that for your client? A very specific example, we had a client who just really loved football, like hyper focused and loving football. It was football season. He was in Aurora, and I mentioned going to the Aurora Day Resource Center, something that he had no idea existed. And, you know, they have computers, they have televisions, they have bathrooms, they have somewhere clients can sit and they can rest. And he would go over there, and it's really just a time to give your client a moment that they're not just trying to drown, that they can rest, that they can rebuild in order to keep going. So utilize the resources that are in the community to really encourage your clients and try to give them hope and drive to keep pushing forward.
Thanks, Jazz. Appreciate you doing that on the spot. Okay, we're gonna move forward. Okay, question number 13. Are you currently able to take care of basic needs like bathing, changing your clothes, using a restroom, getting food and clean water, and other things like that? So this question is a little vague, and we get a lot of questions from the community about what this means exactly. And so what we are asking here and what this question is getting at is if the household has consistent access to these resources. So we're not asking about ADLs. We aren't asking like, are you physically able to change your clothes? But we're rather asking, do you have consistent access to these resources? Okay, this one is pretty long, so bear with me here, but it is a very important one, and something that is used, a specific question that is used for our prioritization. So question number 14 is your current homelessness in any way caused by a relationship that broke down, an unhealthy or abusive relationship, or because family or friends caused you to become evicted? So this question is a little convoluted. So it is inequitable in many ways. And so the first thing I want you all to remember is that this only requires a yes or no answer, right? And our intention with this question is not to get anyone in trouble, but rather to gain a better understanding of the client or household social relationships. So I'm going to read a little bit about this to help understand why this question is so important and to give some context here. So this is a quote that I took directly from the C4 study that I referenced earlier. Blacks in America may have more family members in their social networks and more contact with these network members than whites, which in turn might not result in those contacts causing eviction. Furthermore, Black African Americans may be less likely to perceive or report members of the community as the cause for economic or housing struggles, given that they share with their supports the collective experience of discrimination. This question is also problematically embeds an inquiry of domestic violence situation, which, when paired with a complex phenomenon of women of color underreporting domestic violence or an unhealthy or abusive relationship, may be further unresponsive to the reality of BIPOC clients' experiences. So then C4 asks the question, should having stronger social relationships or a desire to protect one's social supports preclude prioritization of permanent supported housing services? So just keeping in mind that this is a question that was found to be very inequitable and one that C4 talked about a lot and very specifically. So really keeping that in mind as you're asking this question and ways to make that more equitable. Remember, it's those yes or no, and really, if someone is having a hard time answering this, reminding them that this is not intended to get anyone in trouble, right? That's not the intention here. It is simply to gain a better understanding of their situation and what's going on with their social relationships. So this is kind of, right, the rest of the VI-SPDAT has to do with these questions. So I just want to preface this section really quickly. So specifically on the VI-SPDAT for this section, our focus is on if a household has had difficulty obtaining, maintaining, staying in housing or shelter due to a disabling condition. It is not asking if they have a disabling condition. It is asking if they've had trouble with their housing due to the disabling condition. However, on the one home enrollment, we are asking if they have these conditions. So we're kind of asking two things. So in the enrollment, we're saying, do you have a chronic disease? In the VI-SPDAT, we're saying, did this chronic disease lead to homelessness? And we use both of these data points, both the one home enrollment and the VI-SPDAT, when we're determining that prioritization. So remember, for example, in the individual prioritization, that very first one is 3 or more disabling conditions. So we're going to take information from both the one home enrollment and the VI-SPDAT to determine if that person meets that prioritization. So it's really, really important that when you do that one home enrollment, that you are getting the most accurate information as you are able to, or as the client is willing to give. I also want to preface this section a little bit more, specifically around race inequities. So we're going to talk a little bit about the history of healthcare in the BIPOC community. I'm going to read directly from this slide. I know it's a little bit long, but bear with me here. I think it's important to hear out loud. The medical establishment has a long history of mistreating Black Americans, from gruesome experiments on enslaved people to the forced sterilizations of Black women and the infamous Tuskegee syphilis study that withheld treatment from hundreds of Black men for decades to let doctors track the course of the disease. BIPOC are disproportionately affected by a lack of access to quality healthcare, health insurance, etc. Multiple factors contribute to these health inequities, such as underlying chronic conditions, variations in the quality of care, structural racism, and implicit bias. So most recently, we saw this, right, with COVID, that the BIPOC community was disproportionately and is still disproportionately affected by COVID. Clinical encounters in which the stakes of not addressing mistrust are high are specifically in childbirth, childhood vaccination, and the care of patients with HIV, cancer, and substance use disorder. There's some other, truths that happen, around racism in the healthcare community, right? There is a belief that Black people feel less pain, and there's also historically an absence of Black people in anatomy books as well. I want you to keep this in mind as we're going through this section of the VI-SPDAT. Question 15. Have you ever had to leave an apartment, shelter program, or other place you were staying due to your physical health? So it doesn't matter whether the reason was official or unofficial. Does the individual feel that this was the reason, right? So making sure that they were going off of what they think, not what like a professional thinks. Okay, we want to validate how they are feeling about their physical health and whether they felt like they lost their housing due to it. Question 16. Do you have any chronic health issues with your liver, kidneys, stomach, lungs, or heart? Again, with this one, in order to keep it equitable, emphasizing that this requires a yes or no and that no explanation is required. Question 17. Okay, so let me explain this one a little bit further. Org Code created the VI-SPDAT. This is all work done by Org Code. They have intellectual property rights to this assessment. However, they did allow us to change this one question because people were having a hard time understanding it. So the original question was, if there was space available in a program that specifically assists people that live with HIV or AIDS, would that be of interest to you? So this was confusing, and was often creating some confusion when asked. And we were starting to see that people were answering yes to this question because they thought that this question meant like, would you be okay living with someone who has HIV or AIDS? And that is not what this question is asking. So the Org Code allowed us to reword this question. This will be updated very soon in HMIS and on the paper form, like very soon. But right now you can use it, it's fine. It's okay to reword this question as of right now. So the rewording of this question is, people living with HIV/AIDS may be eligible for specific housing opportunities. Would this be something of interest to you or another household member? So in assessments, assessments that are required by HUD, we cannot specifically ask if they have HIV or AIDS. So this is why we decided to reword this question in this way. What we're getting at here is that if they do have HIV or AIDS, are they interested in being in a program that is specific to people who live with HIV or AIDS? We do have at least one program right now in the Denver metro area that serves people or prioritizes those who do have that diagnosis and is a PSH program. So this is just kind of getting at that to make sure that we are placing, right, that people are meeting that eligibility requirement before we're making that match into that specific program. It's also a way to ensure that resources are being used appropriately. So, you know, if someone has this diagnosis of either HIV or AIDS, then giving them that option of a housing option where a qualification is that helps distribute the resources more equitably and appropriately. Question 18. Do you have any disabilities that would limit the type of housing you could access or would make it harder for you to live independently because you need help? And question 19, when you are sick or not feeling well, do you avoid getting help? Some things, so these two questions were found to be pretty inequitable, very inequitable. And the reason for this and some things to keep in mind is that within the BIPOC community, it can be seen as weak to seek out help, especially for males. So again, making this more equitable by reminding the household that these are yes or no answer, that this requires a yes or no answer. There is no explanation that is needed. And just really keeping in mind, right, that this idea or this truth that happens in the BIPOC community around this weakness that is perceived with asking for help. Question 20, are you currently pregnant? In order to be inclusive, this should be asked of all genders, not just those who identify as female. Question 21. Has drinking or drug use led you to being kicked out of an apartment or program where you were staying in the past? A reminder for this question that it is only asking if the housing has been impacted due to substance abuse. That's all we're looking at here, not if they have a substance abuse, if they're working through that or have that trouble, that we're really looking at if they've lost housing because of it. Question 22, will drinking or drug use make it difficult to stay housed or afford housing? Really important, if necessary, if you feel this necessary to remind the household that the answer to this question will not disqualify them from housing resources, right? Going back to that housing first methodology and reminding people that we're going to house them first. It does not matter if they have a mental health issue, a substance abuse issue, a physical health ailment. That does not matter. What we are trying to do is to get them housed, and that the answer specifically to this question, really, well, all questions, but really drive it in with this one, is that this will not disqualify them in any way. Question 23. Have you ever had trouble maintaining housing or been kicked out of an apartment or shelter, or other place you were staying because of a mental health issue or concern, a past head injury, a learning disability, developmental disability, or other impairment? And then question 24. Do you have any mental health or brain issues that would make it hard for you to live independently because you need help? So for these, right, we're talking about mental health. And for these questions, these questions were found to be very inequitable. So what we want you to keep in mind here is that mental health disabilities still hold a very negative stigma, especially within the male BIPOC community. And remind the household that these questions only require a yes or no answer. So really keeping this in mind. Also keeping in mind too, a lack of access as well. That the BIPOC community tends to have a lack of access to healthcare. So even if they have identified, I do want therapy, it has been found to be more difficult for the BIPOC population to get access to that care than the white population. Question 25. Are there any medications a doctor said you should be taking that for whatever reason you are not taking? So in the C4 study that I mentioned, this question was found to be extremely inequitable. So BIPOC single adults are 27 less likely to endorse this subscale than whites. So the subscale refers to actually both of these questions. So the subscale is titled medications. So this question assumes access to adequate medical care in an inquiry about not taking prescribed medications, rather than capturing, for example, unmet treatment need in any form. This is kind of getting back to what I was talking about in the last question, that this question assumes that everyone has equal access to medical care, and that is not the case, right? So it could be that someone, has diabetes and should really be using insulin, but they don't have the correct access to get that medication. So technically the answer to this question would be no, and that would be inequitable because we're asking, right, is a doctor saying that you should be taking it? Well, they never even got to get to a doctor. So really keeping that in mind with this and understanding that this is an inequitable question. Question number 26. Are there any medications like painkillers that you don't take the way the doctor prescribed or where you sell the medication? So this could include taking less than prescribed to make the medication last longer, crushing or chewing pills, or taking more than the prescribed dose. This is another one, right, where we want to make sure that the client knows that this is not in any way meant to get the client in trouble or the household in trouble, and that we just need a yes or no answer. However, I will add a caveat to that, that if your program has high barrier access, only say this if it ensures that it will not limit services provided. So if, say you are doing drug tests at a shelter or something like that, we don't want you to say that this answer will not get you in trouble. So we only want to make sure that service providers who this is true for, that you are saying that. Last question on the VI-SPDAT. So this one we definitely want to preface with yes or no. This is specifically about trauma and abuse. So please preface this question with yes or no, always, as a reminder. Has your current period of homelessness been caused by an experience of emotional, physical, psychological, sexual, or other type of abuse or any other trauma you have experienced? Right, so remember that we start this one with yes or no in order to remind the respondent indirectly that no particular details are being sought. This is actually the only question on the VI-SPDAT that org code did not make. This was written by experts in trauma and abuse and is specifically worded to decrease the likelihood of re-traumatizing someone through the asking of the question. Really hard to ask about abuse and trauma without invoking some sort of emotion usually. So ORCO did did bring in experts in order to try to make this question a little bit more, right, a little bit less traumatizing. All right. So there are some other questions that we added to the assessment that are just for Metro Denver COC. There are only two that I'm going to talk about here, just because they are very specific and I want to provide some clarification around them. So one of the questions that we added was, have you or an adult in your household served in the U.S. military? So this is kind of getting back to our work with Built for Zero and the by name list. There are specific resources dedicated to eligible veterans. And if you are working with a veteran, please refer to the One Home by name list, veteran by name list, instead of the regular One Home community queue. And the second one is very important. So we use this with prioritization. It's, have you had any interactions with the criminal justice system resulting in criminal charges? So this is a prioritization that is used for individuals. And the reason for this is to get at some inequity issues. So you'll see on this chart, and we could talk about the criminal justice system forever. I'm just going to give one example here. Right, this chart is showing us how inequitable the criminal justice system is in regards to incarcerations in state and federal prisons. So this first graph is showing the entire US population, right? So mostly white, so white is around like what, 62%, and the Black population is around, I don't know, 12%. But then if you look at the next graph, you can see the extreme inequity that is happening in state and federal prisons, right? So the majority, the majority of people who are in state and federal prisons are Black, are from the Black population, and then white, and then Hispanic. So we can also see that disparity in the Hispanic group as well, right? Where they have, I don't know, around 17% in the population, but then way more compared to the white population when it comes to being incarcerated. Right? So part of why we chose this as a prioritization is to really try to get at that inequity there. Okay, and then there's contact information and tab in HMIS, and we want to make sure that you're completing this once the VI-SPDAT is done. So, right, please tell us how we can contact you to discuss housing resources and opportunity. Do you want to provide specific locations, phone numbers, anything like that? So this is so that if someone does come up on prioritization and is matched, we can easily find that person. It happens more frequently than I would like for it to happen, that someone is matched and then we cannot get into contact with them. So this is really important that we have any sort of contact available, even if that means, you know, putting in their friend's phone number or someone who's close to them who can relay the message to them. Okay, so we talked about the current living situation earlier in this training, so we're going to go into it more in depth here. So the current living situation is an update in HMIS that ensures a household stays active in one home and on the community queue. This is recommended to be done every 30 to 60 days. So remember, we are not redoing the VI-SPDAT. We are simply doing a current living situation so that we don't have to keep redoing that SPDAT all over and over again. The current living situation also has information in there about vital documents so that as one home is matching people, we can see what vital documents they're working towards or already have. And then really important, just another thing around our inactive policy. So we have a whole inactive policy on our One Home website, but I just want to do a little thing from here. from our policy in quotes. In short, our inactive policy stipulates that following 90 days of inactivity in HMIS, a household will be considered inactive until they reconnect with a community partner. So every month, the One Home teams, myself and my team members go through a list of people who have not had any services within the last 90 days, and we take those people out of One Home and remove them from the community queue. However, if that person re-engages with the coordinated entry system, they can be re-enrolled pretty easily. And all that information is on our One Home website. Okay, so to round out the rest of this training, we're just going to talk about how to move forward, right? So clients are going to normally have a lot of questions around, well, what next? When will I be contacted? You know, when am I going to get housing? So we want to make sure that we're setting some realistic expectations when someone is completing the VI-SPDAT. Okay. So things to keep in mind. Our community does not have sufficient housing resources to be able to meet the need. We recognize that providers often need to have extremely challenging conversations with the households they serve about the availability of housing resources. A main component of prioritization is the need for clear and realistic messaging to people experiencing homelessness. Providers are encouraged to move away from setting harmful and unrealistic expectations that One Home will contact you when your name comes up for housing, and to instead focus on resources a household may be able to access outside of the coordinated entry system, right? So we are not promising anything with this assessment, right? So the assessment is completed. You're being put into the One Home queue, and we also need to work on other housing resources. This is just one option that you are completing and you're done. Good job. And now we're going to look at other housing resources. We're going to keep working towards housing and not just rely on One Home and the VI-SPDAT. We never want to do that. We never want to promise that someone will get housed. We never want to give, a time frame or anything like that, right? That this is one housing option and that there are many others that we also need to work towards. So
Sorry, Nikki, really quick. I just want to add in as well that there is not like a list that the client is on, right? That we are just pulling from the top and that's it. The list is always changing. It's always different because it is a prioritization list, as well as the fact that we are resource-based. We can only house clients in the housing that becomes available, and it may not be the right housing for the person who is, quote, at the top of the list kind of thing. So just making sure to level set with clients. There's no list to check. There's no, ranking system of what number am I and just moving up the list. That's not how this works. I get a lot of questions like that at the help desk from clients, and that's not a thing. So
thanks, Jazz. Yeah, so along with that, there are specifics that answers that we can give households, right? And so these are some things that the households can work on, after they have completed the VI-SPDAT, that are actionable items that can help, move forward in their housing process. So one, we want to make sure that we're telling them they need to keep their contact and location information up to date. Remember, I told you I can't tell you how many matches that we do, and then we have to exit those matches because we simply can't find the person. So really making sure that household notes is keeping up with updating their contact information. Also be sure to update the VI-SPDAT or assessment, right, with that current living situation. If more than a year has passed or significant changes have happened in your life, like say you had a baby, or were diagnosed with a new disability, or have had changes to your income. Those are some very specific examples. And And then, of course, continue to pursue other housing options, services, and benefits. And then this really actionable item that is very, very important is that we want to make sure the household is working towards obtaining their vital documents. So this includes IDs, social security cards, birth certificates, proof of income. You want to make sure that you're keeping copies of those receipts for proof of purchase, because those can be considered as proof when being accepted into housing programs. And if you can, as the case manager, as the staff member, upload those vital documents into HMIS so that they're there in case the client or household loses or misplaces those vital documents that they work so hard to get. The reason for this is that all of the housing resources that go through the coordinated entry process do require vital documents. And as you know, many landlords also require many of these vital documents as well. So you're going to need that no matter what for housing. So that is an actionable item that they can work on immediately. Okay, that is it. We made it. Congratulations.